Welcome to Cork University Hospital. This is a patient information video about having an ultrasound. On the day of the scan, you should enter the hospital via the main entrance. Next, you'll pass reception on your left and continue down a long straight corridor. Before your scan, you will receive a letter with information about the date and time of your appointment. The radiology department is located on the ground floor. You can either take the lift down one floor or take the stairs as shown. If you enter from the accident and emergency side, you will already be on the ground floor. Simply follow the corridor until you see the sign for ultrasound. On your arrival, check in with administrative staff at the reception who will direct you where to go from there. Once we're ready for your scan, you'll meet one of the sonographers who will be looking after you for the day.
Hi, my name is Alana. I'm one of the sonographers working here in Cork University Hospital. On the day of your scan, you'll either be meeting myself or one of my colleagues. An ultrasound is a type of dynamic scan that can be used to investigate new symptoms or monitor known conditions. Ultrasound is a radiation-free test that can be performed on virtually all parts of the body. It's very safe and can be done with patients in different positions or performing different movements to elicit symptoms you might be experiencing. Depending on the type of ultrasound you're having, you may need to fast for the scan and you may need to arrive with a full bladder. The reason for this is so that we have the best chance of identifying what's causing your symptoms. When you fast, a number of things happen. It makes it easier to see and assess your gallbladder and other structures in your abdomen. When we ask you to arrive with a full bladder, this is so that we can assess the pelvis. Doing this means that we have the best chance of finding the cause of your symptoms. Now that all our checks are complete, it's time to start your scan. Once you're ready, we bring you into our ultrasound room where you'll see a small machine with a number of different probes. This is the ultrasound machine. Depending on the scan, we may ask you to lie on your back, on your stomach, or we may ask you to change or move into different positions in order to get the best images possible. If you have mobility issues, please let us know and we can assist you with moving. The ultrasound is performed by placing a thin layer of warm gel on the probe. Next, the probe is placed on your skin and some pressure is applied. Depending on what we're scanning, we may need to apply a bit more pressure in certain areas. The scan usually isn't uncomfortable, but if you do have some discomfort, let us know. At times, we might ask you to take a deep breath in and hold it. This helps us to see certain organs more clearly. If we're doing a scan on your legs to look for a clot, we might have to press over certain areas repeatedly. Don't worry, this is a normal part of the scanning process. If you're having a scan of your pelvis and have been asked to fill your bladder, don't worry. You will be allowed to empty your bladder as soon as we get the images we require. If we are not able to see as clearly as we would like to, there is a chance we might ask your consent to perform a transvaginal ultrasound. This is a test where a probe is inserted into the vagina as it gives clear pictures of the uterus and ovaries. Before this test, we may ask you questions about your last menstrual period. Once we are happy with the images that have been taken, we will give you some tissue to remove any gel and you are free to go. Your scan will be reported by one of our radiologists and the results will be sent to your referring doctor. I hope this video helps with any worries you might have had about your scan. If you do have any questions or queries, please contact us on the following number. Thanks for choosing Cork University Hospital.